on Talk City 91.1 FM for the PAVI program. And I do have in studio with me no stranger to PAVI, although when he calls I don't ever recognize his voice. I don't know why. Bawani, good morning.
Good morning, Ria.
How you doing?
I'm good. TGI.
TGI Friday. TGIF. Woohoo!
You understand?
Yes, it is. And we've also got a Mrs. Hassan Ali.
Sophia.
But Sophia Hassan Ali. I wanted to purposely say Mrs. Hassan Ali. Not the former president's wife. But
she's a joy, eh?
She's really
She's always a joy.
sweet.
Very pleasant lady.
Which Hassan Ali? This one or the former president?
Both
yeah, they're both.
both very
because Sophia, if you don't mind me calling you Sophia.
Yeah, of course.
Really, really, really sweet as well. And it was joyous conversation before, and we're going to continue with joyous conversation.
Looking forward
this
to
morning.
it.
Yeah. So Bawani, what you brung for us this morning?
Well, today is the last Friday of the month of March, believe it or not, already. And 3 months of the year almost gone. This month, well, everybody's celebrating something, including the Glaucoma Association of Trinidad and Tobago. And this morning we have in our studios a representative of TTOA, Trinidad and Tobago Optometrists Association, Ms. Sophia Hassan Ali. We're going to talk about optometry and glaucoma and that kind of stuff and give you whatever information we can. And in between, I'll share some other bits and pieces with you. So let me officially welcome Sophia.
Hi, thank you so much for having me. I'm really excited to be here this morning.
What's your portfolio in TTOA?
I'm actually one of the members of the executive board of TTOA.
Okay, so we're talking to the top. Right. This year, the month of March is Glaucoma Awareness Month, and the week actually is from this year. It was from the 11th to the 16th, if I may remember correctly.
Yep.
But one of the things, I know it was kind of low-key this year. However, let me just interject and say congrats to the president and his staff. Did you see me on the Express sometime last week? I was told I was there because we organized a day when we screened the president and her staff.
Oh, yes.
Yes, the media was there.
I think I did see you actually, now that you mention it. I did, yes.
At the president's house, and that was on World Glaucoma Day itself, the 14th of March. So we did that screening, and that was one of the initiatives. Other than that, what did the TTOA have in its activity sheet? Its activity sheet?
This year, the TTOA held a fundraiser, and most of our proceeds, a good portion of the proceeds, went towards PAVI, which is why you have the inside scoop on what's going on.
Okay.
We've always been big supporters of PAVI, and you all are really doing a great job. I mean, the TTOA, we speak for the optometrists, and I could say that as a body, the organization, as well as most of the companies and the optometrists personally that are part of the organization, all did a lot of educating and screenings throughout the country. I mean, it's definitely our month to shine. So we always try to get out there and let people know the importance of getting their eyes tested. Oh, yeah. Because there are a lot of diseases, specifically glaucoma, that you can't do anything about. So it's very, very important that you do make sure that you are screened annually, regularly, to make sure that everything is on track.
Okay, let's talk a little. It may sound a little controversial because optometrists, ophthalmologists, what is the difference?
An optometrist, we are actually your primary eye care providers. So if you are having problems with your eyes, the first person you should go see is your optometrist. We'll be the ones to let you know if there is any problem, if it's something that could be fixed with glasses, if it's something that we can assist with. If it is something that requires further attention in terms of medication or surgery, that's when we refer you to the ophthalmologist. They're the ones that take care of that nitty-gritty stuff. But we like to make sure that people are aware that we are the primary care. We should be your first step when it comes to you having eye problems. And we'll make sure that you get the attention that you need.
And in terms of prescribing glasses, you all are, or who's responsible?
Yes, so we are the ones that prescribe glasses. Uncorrective refractive errors, which is what you need glasses for, is actually one of the leading causes of vision impairment in the world. So you'd be surprised how many people need glasses and have no idea. These are actually great glasses that you have on, as a matter of fact.
I think 80% of the country blind because all of them wearing glasses. I don't know.
Oh, you really see more and more. And she said that, I think I mentioned to you when I was quite young,
Yeah.
before. My parents didn't realize that
Yeah.
I needed glasses. It's only when we were going to school or going somewhere one time, my mom asked me to read the license plate on a car, and I couldn't see it. And I was close to 8 around then, and then they realized, oh, we need to get her checked. But it made it easier for my brother afterwards because they
Right.
started looking at him, and he started wearing at 8 as well.
You'd be surprised how many children are in need of glasses,
Yeah.
and parents don't know. A lot of the signs that we see in school that we might contribute to children just being restless or
Yeah.
being disruptive, it's because they're actually struggling with their vision.
Yeah.
A lot of times they cannot focus without glasses, and
That's
that's what's giving them a lot of trouble in
Yeah.
classes.
Now, one of the key things that we need to take on board is glasses, yes, but not for style.
No.
Oh, well, that's a common thing now, Abawani. You should see some of these styles out. And the thing is, back in my day, when it was like in the 70s into the 80s, the big glasses.
Yes.
Like the Coca-Cola.
But that's what's back in.
I hated those glasses as a child, and they're back in style.
What's funny is back in the day, you'd have a lot of people that refused to wear glasses even if they needed them. There was such a stigma that
Yeah.
you shouldn't be wearing
Yeah.
glasses. Now we
Yeah,
actually
it's a
have
trend.
patients who want
It's a
glasses.
trend.
It's
It's
like,
a
no, you
trend.
don't need them, but they
But
want it for style.
You've got all kinds of funky kinds of glasses, and now that I'm happy with it, I'm comfortable in my skin with
Right.
glasses. I want all kind of funky pair of
Every
glasses.
personality can find the right pair
Yeah.
of frames these days.
Love it.
If you want something small and subtle, if you want something big, bold, and flashy, you can get it.
I
The
want
perfect.
colours.
Yes.
It's lovely.
Okay, in terms of glaucoma, because since your focus is on glaucoma attacks who?
Glaucoma could attack anybody.
Anybody.
The people that are highest at risk are actually people of African descent over the age of 40, everyone over the age of 60, and anyone with a family history of glaucoma.
Can children get it?
Yes, it is possible. It is possible.
Okay. So, but I mean, it's necessary if a child goes for their eye test that they do a glaucoma test as well, or?
So every eye exam that you take at an optometrist's office, you will be screened for glaucoma. Yes.
All right, great.
I know also that diabetes and cataract, we're getting them younger and younger now too.
Definitely. It's quite unfortunate. And that's also why it's important that everyone get their eyes tested regularly. I mean, we have this stigma that you don't really need glasses until you reach like your older ages. It has that kind of stereotype, or only people who fall into certain categories, but it could be anyone.
Anybody, yeah.
Right. The world has changed so rapidly now that anybody, a long time you used to associate when your grandmother tell you, boy, I have sugar.
Yeah. Yeah.
Tell us about old people business.
Yes.
Yeah.
And
Now we
it's
have
anybody.
diabetes caused by obesity in
Yeah.
young children and all of those.
Yeah.
But the question is was it not prevalent back then, or was it just that people weren't being screened and tested for it?
I think so.
Well, probably it could be.
think
It
that's
could be,
what it was.
It could be both worlds, eh?
Yeah.
I think so.
It could be both worlds. It's like everything else, long time you weren't aware,
Yeah.
but now you have been more aware, and you're seeing more reports surfacing about all kinds of things.
And I think our diet has changed drastically as well.
Oh, yeah.
Since then, so all that affects it even more than it would have back then as well.
Before
So-
we came on air, we talking about
Yeah.
things like you're going in the back and you're picking any old bush and making bhaji, and you survive.
Yeah, you did.
Nowadays, you're going in the back and you're deciding which place you want fried chicken from.
Yeah.
Which doubles vendor you're stopping by.
Exactly.
Nowadays, if you tell a children, bhaji and rice. Not me. They're from the first. One time.
But I love bhajia, although sometimes you don't get nice soft bhaji, you're getting hard one. But I don't like dal. But somehow when my mother makes bhaji, I crave the dal with it.
Oh, I could have dal any day.
Yeah. Naman dali. Dal, rice and bhaji. Tapos sa acha and sani na.
wow, you're saying it. You're saying it. That is it.
Okay. So
Gosh.
let's get back
Yes.
to glaucoma. Now, is glaucoma reversible? Because that's a $1 million question everybody asks.
No,
By the time they hear glaucoma, say, I go lose it, boy, or I could maintain it. Which one?
Glaucoma is actually the leading cause of irreversible blindness in the world. Glaucoma has no cure. When the damage is done, that is done. And that is why it is so important that it is picked up early so that we can try to slow its progression, try to reduce the damage because it cannot be repaired.
And I like the word try because the onus is not just on the optometrist, the onus is on the individual as well. Because if you don't take your medicine and your treatment as is prescribed, then you're helping yourself to go blind faster.
I think I could speak for all medical professionals in Trinidad that the onus is on the patient. No matter what disease that you have, if you're a doctor, if you're optometrist, if we prescribe medication, there is a need for it. And, we only have your best, interest at heart.
But tell me something with glaucoma. Are there any signs or symptoms of it at all, or it's only when you go to the optometrist and they do the glaucoma test? Because I think with once you get your eye test done nowadays, they do all these different types of tests. So is it something that you might detect from before, or it's something that the optometrist or the ophthalmologist has to see?
So glaucoma actually has the nickname as the thief in the night.
There you
Often
go.
it does not show symptoms. So don't wait for symptoms. And it's the lack of awareness and the lack of symptoms that's reason why people often get detected and diagnosed late.
Late, yeah.
So the first sign is often the loss of peripheral or side vision. And that could often go unnoticed until it actually reaches your central vision. So it kind of caves in, becomes a tunnel vision kind of effect. And by the time people notice it, it's too late. It's too late.
Well, okay, I don't think you actually said, just for people who don't know exactly what glaucoma is. What
Right,
is it
yeah.
Exactly.
So glaucoma is actually a group of diseases that damage the eye's optic nerve. And this is what results in vision loss and blindness.
Okay. So there you go.
Right. So in terms of the treatment now, what I know it is based on an individual case. They will give you the appropriate medicines, that will deal with your case because on a one-on-one. But in terms of how people should do that, in terms of taking it regularly, resting the eyes, all of these things. What are some of the tips that once you discover that you have glaucoma?
Right. Well, once you discover that you have glaucoma, I'd like to reiterate that there is no cure. We cannot fix what's already been damaged, but we can try to pick it up before too much damage occurs. Now, the only clinically proven treatment for glaucoma is to lower the pressure of the eye. Now, that's actually what causes the damage to the optic nerve in majority of cases. There are exceptions, but in most cases what happens is the pressure in the eye builds up and it actually pushes down. It basically smushes the optic nerve and damages it. So when you use the necessary drops that the ophthalmologist will prescribe, which are for life, I must add. These drops you are on for life.
Wow.
It's not a matter of using it for a month, for 3 months. It's not a matter of using it until the prescription is done. It is continuous because once you stop, the pressure could build back up and that's what can cause more trouble. So the main thing is to stay on your drops, your medication, to make sure that you keep your regular eye examinations. So that way we can make sure that the pressure is being controlled by the medication, or if we need to change the medication, increase the dosage, anything of that nature. Aside from that, there are regular tests that we perform in order to monitor the optic nerve health. So you have tests like a visual field test, you have the OCT test, and these all manage and can monitor the health of the optic nerve, its functionality. And that's what we like to make sure everyone's aware of, that you have to keep your appointments, stay on top of it, make sure that you keep taking your medication. Because like I said, your eye doctors, your ophthalmologists, your optometrists, we all want your best interest at heart. So please, take our advice.
How do diabetes and high blood pressure, if at all, affect glaucoma?
Well, glaucoma is not necessarily affected, but diabetes and high blood pressure, they do damage and they do alter the way that your
They
body
contribute.
functions.
Right.
Exactly. When your
So they
body
just make a bad situation worse. In other words.
precisely, yeah.
But not to scare anybody. You can have
No,
what
we need to scare people, Mawani, because they need to go for their test.
But people need to know that, I mean, you could have glaucoma, cataract, and
That
diabetic
is what
eye
I was
bleeding
coming to.
all at
That is what I was
once.
At
coming
once,
to.
yeah.
And it's a reality, people. You can.
Oh,
it
yes.
is, it is. And that's why we need to be so careful how we manage our diet and how we manage our health, you know?
That health is very important.
Yes.
And just don't put anything in the eye. Are they walking up one of them streets? A madman see me, say, boy, wash your eye with young okra.
Oh, no, please.
No, I mean, I ain't a key on. But you know,
What is that supposed to do?
I don't know.
Lubricate the eye?
Oh, we hear all sorts of things in the office. You have no idea. But I mean, this goes back to our talk about bhaji earlier. Your okra and your bhaji. These are the kind of
To
things
eat.
that keep
To
you
eat.
to eat,
Yes.
not to put in your eyes.
mouth, not your eye.
Yeah, you know, it's very important to have a healthy lifestyle in general.
All right, this is the PAVI segment here on Talk City 91.1 FM. It's done on the last Friday of each month, more or less. And we're talking about we're talking to a representative of the Optometry Association of Trinidad and Tobago, Miss Sophia Hassan Ali. And we're talking about glaucoma and, things that are basically related to the Optometry Association. We know that these days, the rays of the sun and the heat of the sun and Sahara, coupled with Sahara dust, coupled with, and I say extensive because the bushfires are having a field day.
Yeah, boy.
And that is a distraction. How can we protect ourselves from these things?
I would say the first piece of advice would be make sure you're wearing your protective eyewear. If you're working outside, always wear your safety goggles. If you're just walking down the road, wear a pair of sunglasses. That in itself would try to reduce the amount of that. All of the Sahara dust, all of the other pollen, all of the other things in the air from getting into your eye. Next up would be to make sure that your eyes are well lubricated. We don't want your eyes to be dry, itchy, irritable. Once your eyes are well lubricated, any of those things that get into your eye will flow out nicely. So you don't have to worry about anything sticking and just aggravating your eyes. Keep yourself hydrated. And if you do feel any symptoms of redness, itching, puffy eyes, any kinds of watering, pain, come on in to see your optometrist. Please don't rush to the pharmacy. It could be a number of things. It could be an allergic reaction to the Sahara dust. It could be a virus. It could be bacterial. We know how to help you. Please don't try and fix it yourself. Just come on into any of your local optometrists and we'll steer you in the right direction.
And some of us have a very bad habit. We take the hand and we scratch the eye.
Oh, yeah.
And we do all kind of madness with it. But the hands may be
Dirty.
soiled.
Yes. And a lot of times scratching and itching is going to aggravate things even more.
And you know something, since I started wearing contacts when I was about 20, it's like 20 something years ago, I learned not to
Yes.
put my hand in my eyes, and since then I don't at all touch my eyes
is
with
a good
anything.
thing.
I've learned that not to do that.
Well, I'd like to add in now that you mentioned contact lenses that if you do experience any of those symptoms, please stop wearing your contacts. Grab those backup glasses. They may not be in the best condition, but it's much better than your contacts getting contaminated. And we don't want to worry about
And
that.
especially with all the dust now
Of
in the air,
course,
it's
of
even
course.
easier
Very
for those
dusty.
to get, yeah.
I tell all my patients, try and keep your glasses handy if ever you're getting any of that irritation.
Yeah.
That's the contact wearing people.
Yeah. Yeah.
Nowadays, so many more people are wearing contacts. It's the most fashionable thing. It's easy. It's convenient.
Yeah, but after wearing contact lenses for some 29 years, you kind of get tired of it after a while. And then depending on how bad your vision is
Right.
and your different things, sometimes you don't get the right fit, the right this, the right that, and it's one thing or the other, the right vision. So you just opt for what I went for, as
glasses.
Bhavani knows.
Yeah.
Glasses, yes, and then because I had congenital cataracts, did
Right.
the
Yeah.
surgery,
So you
and
have
I'm
all of
fine. Woohoo, at last.
Bounce back,
Congratulations.
bounce back.
I just have to use these for reading, and I'm good with that.
Just make sure
What
you
about
have
driving,
regular
please?
exams.
I know
I don't
some
need it.
people have
I don't
different
need it.
pairs of glasses for
No. I
different
don't
things.
need it. I don't need it for driving at all. I'm fine. It's just reading, and this is like short distance type reading, and I'm good.
Well, a lot of that, I must say now, please don't take offense, but a lot of that comes with age.
I know.
Yeah, yeah.
Oh no, I had progressives as soon as I
Well,
crossed 40.
there you go.
I
There you
crossed
go.
40 and bam, progressives.
A lot of people don't realize, I mean, they understand this concept of nearsightedness, farsightedness, but once you reach 40, there's no backing out from
downhill.
there. Exactly. I mean, I tell my patients sometimes the symptoms start to kick in a couple years before, a couple years after, and sometimes it's the day you blow out the
40.
candles.
Yes,
Wow,
I
wow.
kid you not, and I warned my brother it's gonna happen to
It
you.
is,
I'm
and
so
you know
sad,
what?
So done.
It's so normal though, and I wish people understood how normal it is
Yeah,
to start
it
experiencing
is.
some of these vision difficulties as
Yeah.
you approach 40. And once you start experiencing it, please come on in. Just come on in, get
There are
your
too
eyes
many- there are
tested.
Too many people who live in denial still.
Yeah, I know, but I mean, hey, spectacles, glasses. Well, I don't even call it spectacles because that's an old word term for it. But glasses.
Hey, we still use it.
They're fashionable people now, you know. It's not like,
Yeah.
oh, look what she wearing. They have Coca-Cola, but no. No, they're fashionable. So, you know, come on, you know, do your test.
All
I don't
right.
know if, Bhavani, I know you have other things to say, but I don't know if part of the problem is maybe the cost as well that, you know, prevents people
Yeah, that could be.
from actually going for these tests, especially with the little children and everything. So,
Well, the cost of, I think, everything in the country these days is a bit of
yeah,
a problem,
it
but we're
is.
not going to get into that.
But when you evaluate it, it is better
your
than spending money
health,
up front
yes, your health is-
Exactly.
and do what
most
is
important.
necessary.
And you know what? I mean, it's a lot of money sometimes to fork out at once. But keep in mind, you look at a pair of shoes. Let's say you go and you spend maybe 400-500 on a pair of shoes. And that one pair of shoes you're going to wear maybe once, twice a week, maybe 3-4 times.
Ladies more so, eh?
Well, no, ladies, it's once a week, one for Monday, one for Tuesday, one for Wednesday, etc. But your glasses, you wear them all day,
All day,
every
all the time,
day.
all
And
day.
whether you wear them for 1 year or 2 years, please don't ever exceed that.
Yeah.
You get your money's worth.
And not only that, many optometrists, stores, if you want to call them that, they do offer free tests now.
Yeah.
And maybe half off your glasses or something. So they're really
have
good
incentives.
bargains.
There are a
Yeah,
lot
really
of
good,
specials
yeah.
nowadays.
So,
A lot of
yeah.
places have discounts for students, have
Yeah.
discounts for senior citizens. Even if you have any of these other discount cards or companies or
Yeah,
insurance
they would,
companies.
yeah.
Yeah, I mean, nowadays we really try to make it as affordable,
yeah.
as accessible to everyone because there is a great need and there are far, far too many people in the country who are, who are suffering unnecessarily.
Yeah. Yeah. Really.
And I see we have more and more eye companies and sellers on the market now than we've ever had before.
And we still have too many people who have
Don't
eye
access
diseases
them,
that
yeah.
are being undiagnosed. So I mean, we could just keep on going, and until the country actually reaches a point where everyone is served, I think we still need more.
Yeah.
I mean, there's a reason that we have all of these general physicians popping up everywhere because there's a need. And it's the same thing for optometrists. Like I said, we are your primary eye care people. So it's important. I think we need more of us.
Yeah.
Okay,
Definitely.
okay. We need more. We need more of you. But there must be checks and balances because I get worried when I hear things springing up, and you don't know,
How much you can trust them, how
much you can
trustworthy
trust,
they
whether
are.
it's genuinity
Yeah.
or people just out for making money or whatever the case might
So
be.
that's actually where the TTOA comes in. So as the Optometry Association, we have to make sure that everyone is registered.
Okay.
So that is the first thing. When you are going to find an optometrist, if you're unsure if it is a reputable person or a reputable company, you can always go onto the Trinidad and Tobago Optometrists Association website. Every year also, we published a list of all of the certified and registered optometrists in the
Which is good.
country.
Yeah.
Yes, do a little bit of research. It's not that difficult. And you want to make sure that you are getting your money's
Yeah,
worth.
exactly.
Because there is a big difference. And I mean, it's unfortunate how many patients I might see in a day that be like, well, I tested my eyes last year and they didn't do half of these tests.
Yeah.
So it is important.
Yeah, it is.
So you have to do some homework for yourself.
Yes, yes.
And make sure that you go to the right people at the right time. You know,
Most
and that is
definitely.
very important. Well, I don't know how much time we have again. Because
6 minutes.
we just have 6 minutes. So let me fill you in on some of the activities and then we'll come to our closing remarks. Sorry. We could take one or two quick
Yeah,
calls.
if anybody wants a call,
Yeah,
622-4911. You can give us a call, 622-4911.
No, we're not going to
It's
diagnose
important.
nobody on air.
No,
so
we
please,
can't. No, you
please,
need to
please.
go in to
You
the
know-
optometrist and be diagnosed.
Yes.
So
you can give us a quick call.
622-4911,
In the mean-
622-4911.
In the meantime and in between time, let me remind you and let me say thanks to the Down Syndrome Family Network. They had a big day last week, Thursday. It's becoming a very big event, Down Syndrome Day.
You should have seen my socks.
Yeah, World Down Syndrome Day.
Loved it.
And they had the conference in Trinidad on the 22nd. They also had their Tobago conference on Monday gone. And before that, we had a special meeting at the U.S. Embassy. One of the speakers at the World Down Syndrome Forum was the CARICOM Rapporteur on Disabilities, Senator Floyd Morris of Jamaica. Floyd is visually impaired.
Yeah.
He's been in the Senate of Jamaica for some time, and he came to give us an insight as to his role as the CARICOM Rapporteur on Disabilities. So I'll be sharing some of that with you next month, and something that you can look forward to. Let's also say congratulations to Power Gen once again, putting on a splendid day for over 1,000 children from Trinidad, Tobago, and one school from Barbados at their Power Gen Fund Day. It was the 27th occasion on which they had that event out there in Pinal last week, Wednesday, and yours truly was part of that.
We have a call. Want to take it?
Let's see. Good morning.
Hello, welcome.
Good morning.
Hi.
Yes, sir.
Yes, I want to find out something. I went to
Don't call any
a
names, eh?
hospital
He-
with an eye problem. One of the doctor examined my eyes. He told me he have a cataract. And next doctor comes to me, same Mount Hope Hospital, come and watch the same eye and tell me I have glaucoma. So how two of them could give me two different things in the eye on the same day? They give me medicine now to put in the eye. I want to put it in the eye. It make me both eye blind.
Oh,
Oh, Lord.
okay.
All right. Well, that's quite an unfortunate situation, but I'll tell you this. As we mentioned earlier, it is very possible for you to have cataract and glaucoma.
And diabetes.
And diabetes and a slew of other possibilities at the same time. Now, cataract is something that most commonly comes with age. I don't want people to think that it is a horrible, unavoidable disease. It is something very common with age.
But I've seen some young people with cataract as
Yes,
well.
yes,
Yeah,
of course,
yeah.
of course. It
And I
is
was born with
possible.
it, so there you go.
Yeah.
Yeah.
But it's something you can't really escape too much.
Yeah.
Yeah, what I'm saying, on the same day, you know.
Yeah.
Yeah, that
Okay, if two of them is eye specialists, if both of them should have physical glaucoma in the same eye,
Well, yeah.
why
well,
you tell me, one tell me is cataract and next one tell me is glaucoma?
Yeah, well. And it's unfortunate you lost your sight now.
So what cataract is like a dirty window. And if the window is too dirty, what happens is you have difficulty seeing out, which is why you feel like your vision is diminishing, why you might feel like you're going blind. But likewise, the eye specialists have difficulty looking in. So sometimes that could be part of the reason why these kinds of situations occur. I can't really say I haven't had a look in your eye, but I do want to make sure that you understand that the optic nerve is the data cable connecting the back of the eye to the brain. And when that cable is damaged, that is what could have also led to the vision diminishing. All of that, and also, like I said, if it's reached the point where it's gone too far, that could have led to the vision loss. It's a
What
lot
I'm
of things
saying-
going on at once.
Yeah,
What
well,
I'm saying, the same day,
Yeah, but what
We
she's
we
what
understand
she's
that.
saying,
different
yeah.
doctors give me
Right.
two different.
yeah, we
But
understand.
what she
For
tried,
that-
we know. But what she tried to say is that maybe one caught it and the other didn't, because with the cataract, it blocks not only your vision but the doctor's vision of getting to see into your eye as well. So maybe the other extensive one, who probably did a more extensive look
Research,
into your eye, would have seen it. And for all you know, maybe he referred the other doctor to come see you or check you or something. And
He wanted a second opinion.
Yeah.
You know, so all of these things are possible. But
Yeah.
as Ms. Hassan Ali said, that if the eyes are dirty, inside and outside,
hard
it's
to
difficult
see,
to
yeah.
see.
In
All
and
right.
out.
Thank you very much for your call.
All right, thanks for your call.
All right, I realize we have just a few minutes, and just want to let you know that what's happening with PAVI tomorrow, please God, we go to Toco Loco. Yes. We're doing a descriptive tour from Mount Hope Hospital right up to Toco. We're getting a chance to bathe off and to soak in some of the sea salt. So that's happening tomorrow. We have 28 persons who are making the journey with us, and we want to thank Jay Tours for helping us to organize that. So
It sounds wonderful.
that's a descriptive tour that's happening tomorrow. PAVI's special meeting, which was supposed to have been last Saturday, will now be on the 27th of April. And although all the tickets are sold out for the TTOA event at the what do they call that restaurant down
Svada.
Svada. At
Delicious
One Woodward
Indian
Place.
restaurant.
You can still call PAVI's office at 220-1073. We may have about 2 or 3 tickets left. And you have until April 7th to avail yourself of that thing. We're planning to have a group live next week Friday sometime down there, to celebrate the people who are celebrating the Aries people. Let me put it that way. The Aries people, all those who were born in the month of Aries, of March, April.
Yeah.
Right. Other than that, well, I can tell you now that we will be having a blind cricket regional tournament later this year in Guyana, and of course, IPL. We have an IPL going on now,
Yeah.
We're supposed to have a blind IPL sometime
Very
October,
good.
November. So
Nice.
things are on the move, and also Tuesday is World Autism Day, and World Autism Month is normally the month of April. Your blue lights signifies. So I understand the Autistic Society is having something. And the National Enrichment Center, they are now available for organizations involved in the work for persons with disabilities. We're going to have a meeting, a seminar, and that kind of thing. They are looking at expanding the therapeutic services, aquatherapy and stuff like that. But you can talk to the center manager about how you can make use of the facilities. They're very nice facilities, which is in central Trinidad for a change, because we know in time immemorial everything was south or north based, but we're happy being a central boy. I stand with pride to say I don't have to go too far again. So that's a lot of good things are happening. The national policy for persons with disability. I understand today there is some discussion about an NGO bill. Sorry I got that late, but it will be interesting to see what are the new amendments to the company's law as it relates to non-governmental organizations. So that's something that we're going to be talking about in the future. And May is the month of blindness. We are supposed to have a meeting of the North American and Caribbean region of World Blind Union here in Trinidad on May the 31st. So it means I may be coming live from that opening ceremony. We'll have to talk about that. And PAVI will be having its walk around the Queen's Park Savannah on May the 25th from 3 to 6 p.m. And if you're interested, you can call PAVI's office. Check our Facebook page and you will get a lot more information. If you need to support our initiative, support the organization, cash, kind, or anyhow, then in a positive way, you can call us at 220-1073, and you can also visit our Facebook page. And well, here's where Sophia gets the chance to give you her last closing words.
Thank you so much. I have to make sure I can keep track of all these PAVI dates. I just want to let everyone know that Caribbean people are approximately 4 times more likely to contract glaucoma than our Caucasian neighbors. So I want people to understand that glaucoma is a serious, serious concern here in Trinidad. Throughout the Caribbean, numerous studies have actually found that, especially in the Afro-Caribbean communities, more than half that have glaucoma don't even know it. So we really, really want to make sure that everyone comes out to their local optometrists, call, make an appointment, and get your eyes tested. Have your loved one's eyes tested. And just make sure that if there is any disease, it is caught early, you get the proper treatment early, and you get the assistance because you don't want to suffer vision loss. It changes your entire life, and we all want to make sure that our loved ones are taken care of as best as possible.
So true, so true. As I always say on this program, an ounce of prevention is always better than a pound of cure. Yeah, that's where we're going to put it away for this month. Next month, with the good Lord willing and the creeps don't rise, we'll catch you back on the 26th according to my dates. And we'll have some, as usual, interesting features for you. In the meantime and in between time, take care of your eyes because it is very important to you. And be good to yourselves, love thy neighbor as thyself, and let's live and love in peace, love and happiness. World Happiness Day was March 20th. I was very happy. I always have happy, yeah?
Yeah, you always are.
Yeah,
That's one thing. You always are.
Why be anything else?
Exactly.